Good afternoon, and welcome to your Perfect Practice webinar, Documenting Vaccines and Medications. Can it be quick and painless? I'm your moderator, Nancy Roberts. This webinar is presented to you by EHR Integration Services, charter member of the Perfect Practice Alliance. Here's a quick look at today's agenda. We'll begin with a brief introduction to today's host, EHR Integration Services, give you a quick overview of the Perfect Practice Alliance, and then introduce you to our presenters for today's webinar and demonstration. After you've learned about a real-world experience with this time-saving device and seen the application in action, we'll take a few moments to answer your questions. So let's get started. First, for anyone who might not already be acquainted with EHR Integration Services, this innovative and industry-leading organization has been, since its inception, involved in transforming the way people manage information, develop workflow, and enhance knowledge within the medical practice. For EHR Integration Services, healthcare information technology is more than data, computers, software, and networks. It's about people. For more information about EHRIS, at ehrintegration.com. Today's webinar is a service of the Perfect Practice Alliance, a collaborative group of healthcare business partners comprised of physicians, IT experts, and industry-savvy consultants. The PPA was founded by 3 charter member organizations, EHR Integration Services, Bite-Size Solutions, and National Physician Services. The charter members set the strategic direction for the Alliance, and each member brings a complementary set of health information technology products and services to the organization, along with expert consultants and staff. And now, because we want to make sure that we answer all of your questions, you want to just locate this Questions tab in your control panel, and at any time during the presentation, you can ask a question electronically by simply typing this space, and we'll address it when we're in the question and answer session as we wrap up today's webinar. So now I'm going to be turning things over to our panel, who will tell you and show you more about this groundbreaking new add-on application for Allscripts TouchWorks. From EHR Integration Services, we welcome consultant Rochelle Herbert, and to help demonstrate this application and importantly, address it from the point of view of a large medical practice that has actually implemented this add-on with great success, let me introduce you to Colette Ashley, business analyst from Murfreesboro Medical Clinic. Welcome. And Rochelle?
I would first like to introduce our 2 new products that we have. We've decided that the immunization workflow that we're all so familiar with within TouchWorks that involves so many clicks, as well as the medication administration piece, was in dire need of some help to actually utilize those little 2D barcodes that are on the vials. And so we were actually able to create 2 different modules that will help streamline your practice and take a lot of those clicks away from your everyday workflows and actually transition that into scans. So go ahead and go to the next slide here, Nancy. And so what we actually like to show here is, as you know, many of the different clicks within TouchWorks for immunizations in MedAdmin actually come from either a note, a care guide, or within the ACI. Within the ACI, it's approximately 15 clicks to click through just those immunization details or MedAdmin details. And so as you can imagine, the lots, the manufacturers, the NDCs, all those different areas that you're clicking through, we've come up with the software that will actually allow you to put the defaults in the background and actually click through using a barcode scanner, a 2D barcode scanner, and enter all of that right back into TouchWorks. So go ahead and go to the next slide, Nancy. So what we've done is your clinic will actually set up the appropriate groups within. And Colette will go through this and how Murfreesboro actually set up their process. But to show you that we've taken those 15 clicks away, actually have been able to group in different pediatric groups, 2-month shots, 4-month shots, etc. By ordering all those in one click, then you're able to scan the vial right on the, or scan the vial of the barcode on the vial. Then you can also scan sites. So we've created different barcodes specifically for sites. And then we've also created a save barcode. So you can virtually do all of these steps within 4 clicks rather than the 15 clicks by having the default set up in the back. So with that said, I'm actually going to turn it over to Colette with Murfreesboro Medical Clinic. She's going to show us and tell us a little bit about the clinic first, as well as kind of go into their success story and how they've implemented. Then I'll be back on and I'll kind of show you the admin side as well as a look at the med admin side. So Colette, take it away.
Okay. Murfreesboro Medical Clinic is a multi-specialty organization with 70 providers and 25 mid-level. We have close to 600 total employees, and there are 15 pediatricians. During our peak seasons, we can give almost 1,400 vaccines per week. And so our nurses were spending 30 minutes to an hour entering immunization information at the end of every day. And they didn't have time to do it in between appointments. So MMC approached EHRIS about a better solution, and so now we use Barcode Reader. Now the nurses can enter all information before they walk in the patient's room. Our shot records are available before the patient leaves. We can have accurate clinical summaries by the time the patient checks out. We have our barcode tab set up under our providers and our nurses' workspace. As you can see on the right, we have a list of immunizations. Some of them are groups and some individual vaccines. Most of the groups are based on the patient's age, but we have groups set up for specific providers who do things differently. Here at MMC, we also have nurses that will float through the department, so they need to be able to change their order by physician, and so they can type that in here. And it will pull directly from our user provider dictionary. And then we all know that every patient is a little different, so if I need to edit the immunizations in a group, I will click on the plus beside that group. And from here, I can add or delete any immunization. So if I don't want the Hep A, I'll just click that and remove it. So once I hit save, everything on this screen will be ordered. And then if I'm from this screen and I want to order a medication, I would just click on the check beside it. And then if something happens, I've made a mistake and I don't really need the Prevnar, I can hit this EIE and it removes it from my list. So now I'm ready to enter my information. I'll click on this MMR. And as you can see, a lot of this information is already defaulted in. Our manufacturer, the dose, the route. We can also say whether we can default yes to the VIS was given and the date of the publication. We also participate in the state immunization registry. So the VFC eligibility status is required. And this is automatically set up to pull in the correct status based on whatever insurance that patient has. So now that I'm ready to scan, my cursor is already in the scanner box, so I'll just scan my vial. And then I'll scan my site, and then I'll scan save. And it drops off my list. So I also have a Verivax here and can show you how quick it goes. To scan my vial, scan my site, and scan save. Then I can move over to the clinical desktop. And it sometimes takes just a minute for these to show up. But there you see the MMR that I just scanned, and if I click on it, all the information I just entered is there. And that's all we have to do, and it is saving us a lot of time. I'll turn it back over to Rochelle to show you more of the admin side.
Okay, so I'm actually showing very similar to what Colette had here a little bit ago versus our system versus their system. So just kind of showing a little bit of the setup side to this. It's actually a really easy setup side. A couple of things just to call out as well. I don't know if you saw when Colette was scanning those immunizations, it said she was the admin by. It also showed the ordered by, and that defaulted for her for Dr. Harrison. All of those settings actually reside from your default supervisor and provider settings. So this, if you have that set up within TouchWorks, that preference, you can leave that if that's who that nurse is going to work with all the time. Otherwise, you'll see where Colette showed that ordered by, you can do that as well and type in a physician there. So just wanted to say where that was actually coming from. As far as the actual admin side of this is all set up based off this admin access section or tab, and this pulls directly from your user provider dictionary. So whatever users you want to gain access, we've seen in some clinics where they want the clinical staff manager within the different departments to get that access and actually update some of those medications and immunizations. We've also seen in other clinics where they just want staff to actually have it within the IT department, and then they'll put all those requests in. So based off whoever has admin access is actually who will get that admin page. Within here as well, this admin page then is what that grants access to. So if I click over the admin page, I just want to show how easy it is to actually add in these different groups and items that Colette had shown earlier. So like she said, they've organized their system so that it has based off either the CDC kind of standard immunization groups. They had a couple one-off ones, as well as they had a couple of physicians that did things a little bit different. So I'm actually going to just show how to add in a specific physician one. So I'm just going to continue on with my Dr. Smith. My next pattern one is a 2-year. I can hit add there. And so at that point, my 2-year was added right here. And then my actual items that I want to assign to that are within here. One of the items that I want to put in there is actually the influenza, not the nasal. So I can actually go and I can just type in influenza. Oops, if I spell it right, I apologize. There, click add. And what this does is actually opens up what we call all those admin defaults. The list over here on the left-hand side is actually pulling directly from your immunization dictionaries. Whoops, and I did the same thing again. Immunization dictionaries right within TouchWorks. So you'll see that influenza specifically, I have quite a few of those. I'm going to just pick the top one for this. I can, in the background, then set up all of those different settings as well. So the dose for this I know is 0.5. My manufacturer that's on my vial here happens to be a Merck. My route I know is IM for this one. I'm going to leave that site because that's going to vary, and like I showed on that slide deck before, we can customize a barcode for you for those different sites. So if you do the right side, the 1 2-month appointment, and then the 4-month appointment, you do the left side, we can set those up for you as well. The NDC field that we're working on right now, you can default those in if, for example, you don't have something that's scanning really well, because unfortunately not all the manufacturers have vials that are perfect yet. We've seen a lot of them are. But however, if you do want to do that, as well as this NDC field is used for, if you want to say as a precautionary, I'm making an influenza one here. If somebody were to scan in a Prevnar and I had the NDC of an influenza, but my Prevnar one was scanned, it's going to pop up an alert for you saying, wait a minute, you scanned a Prevnar, but you're on influenza. So it's kind of that second double check. So that we're also working on, and that should be released by early next week. This NDC format, thinking back to Colette's little scan and an entry, NDC, what we've done with that is we heard from so many clinics that that 11th digit was actually missing. And so what we did, we added in the functionality so that based off whatever pattern is actually on that vial, so Merck happens to be a 442 pattern. Some of the other ones that I have here are 532, 541. So hovering over those, you can see what place that 0 is going to go in. Therefore, eliminating that nurse having to know for billing purposes what's the correct spot for that extra 0. So I'm going to mark this, since it's a Merck one that I'm doing, as a 442. These VIS can actually be set as well. So we know how long it takes to actually go through TouchWorks, click the yes for VIS, and then go back and click on that calendar. We've actually added it so that within here, this VIS for influenza happens to be 8/7 of 2015 from the CDC one that I have. And so I can quickly type that in, and it's already jumped back all the way to August of 15. This lot number and expiration date, we've also added in. There are a couple manufacturers yet that have not gone to the 2D barcode. They still are using the 1D barcode. So again, that 2D barcode contains the NDC, the lot number, and the expiration number. If it's the 1D barcode, which is a long barcode, you're actually going to just get the NDC number. So we added this functionality in so that you can default those lot numbers and expirations, still scan that vial for the alert, and all of that information will save. So that's the background. I'm going to hit save here. You're going to see that my influenza was now added down here. I can then go back right over to my 2-year, and I can say and start attaching. This screen looks very similar to that plus screen on the home page. And so I can say I want my influenza over here, I'm going to need a Prevnar over here, etc. So you kind of save and update those. Once I've updated that, I can go right back to the home page, and already that Dr. Smith's 2-year becomes available. So it's that quick for entry. We often say too, if you hover over each one of these, it's going to show you which one or which immunizations are actually linked to that. So if you come down here to the PEDS ones, you can see there's actually 4 immunizations linked to those as well. So just as another checkpoint. So with that said, that's kind of the immunization side. So we're super excited to be able to do those. One more thing that I will mention that often comes up as a question, so hopefully I can answer that before it comes in. If your practices are already using workflows where the physicians are putting in, immunizations within notes, care guides, or the ACI, you can still have that process in place. They can still be ordered within the TouchWorks side, I say. If they were ordered over there, they would actually just show up in this hold for administration. And at that time, the nurses can still utilize this list for the patient and still utilize the barcode reader. So I just wanted to point that out as well. With that, I'm actually going to switch over and actually show you the medication administration tab. So you're going to see, based off what I showed you before, it's going to look pretty similar. So there's a couple of different ways. We can do it so that it's 2 different tabs within, which is kind of what I'm showing here, back and forth between immunization and med admin. This will be a system setting based off what you choose to do within your clinic. Or you could have just one single barcode application and have kind of what we call the toggle back and forth between immunization and med admin. So it's kind of dependent upon what settings you would want. Within the med admin side, you're going to see the same functionality that you had before within the ordered by. So if you need to pick a different ordering physician, you by all means can. You're also going to see a new field here that says linked problem. And so what we've done here is actually pulled in the problem list that that patient currently has as an active problem in TouchWorks. And so today, if I were going to use this one, I'm going to say it's a bursitis. I can actually say that I'm going to go do my catalog, and so you'll just have a single doses here versus like immunizations where you sell multiple. The EIE functionality is still within. I can click on my catalog. I can pick up my scanner, and again, you're going to see that some of those doses have been automatically defaulted in. I just scan my scanner, and I'll point out again here, whatever that additional 0 got added, that's actually going to show in red where that was, so I'm kind of circling that. I'm going to scan in my site, and then I'm going to scan on my save button. And so you can see that I've quickly done that medication admin with the defaults that were already set up in the back. A little bit of a difference between med admin and immunization admin, which you all know this as well, is that all of this information from the med admin side actually doesn't go under the order side. It actually will go under the meds, underneath the medications tab or within the medication flow sheet tab. So you're actually going to see as this goes through, again, it takes just a couple of seconds, it actually will come through, it will turn it around, and it will actually show as completed. As it's being a little slow. As it's being a little slow, I'm going to just pop over and I'm going to go show the admin side of that while it loads over. So the admin side, you're going to see that it's set up very similar to that immunization side. Same access applies. So you'll see that that tape or that screen is the same screen as within the immunization area. If I go over to the admin page, I can quickly add a brand new item. I can click add, and the differences here are actually that it's going to pull in the medication dictionary, and as we know as well that medication dictionary is a huge dictionary to actually pull. And so if you type in parts of the first little part of this, of the word, and you hit the go, you're actually going to be able to find that medication, excuse me. You'll see that we added this link so that you can actually tell due to that medication dictionary being so long. I can pick whatever dose I would have. I can document my manufacturer. I can document my route. I could leave my site, or I could add in a default site. Some of the places I like to say too, if you need a default site, back to immunization, would be like a Rototest where you're going to give it orally. You can put that in as well as the other right away. The NDC piece will also go the same way, so it'll work the same way as immunization. So if there's something entered there and it looks like you're entering a different medication, it will alert you, as well as you have the different formats here right off the vial as well from the NDC number. So I can hit save, and just as quick as that, you see that it's in my items, and on my home page, it's actually ready to go here. I'm going to just come back and I'm going to show that clinical desktop as it took, for whatever reason, a little bit longer. I'm going to actually show my past meds and my medication flow sheet. What's going to show in my flow sheet here is that that's now been completed, linked to my correct problem. It was administered just like I gave it. If I look at my past medications here, I'm going to see it as well in there. And just like Colette showed on their side with the immunizations, it does just that on this side as well. So all of those medications come in and all the details come through as well. So that is the med admin side. So Nancy, I'm going to turn it back to you, and we can open it up for some questions.
Okay, very good. We got quite a few questions, actually, so I'm going to start with one that I think is probably everybody's going to be curious about, and that is, give me a sense of the time savings. We talked about the number of clicks, but give me a sense of the time savings when entering an immunization via the barcode reader versus updating the immunization information through TouchWorks.
Well, I can tell you from our experience, it takes about 1 minute and 20 seconds to go through all of the, putting in all of the information for an immunization. And when we do 1,400 in a week, that can save us almost 30 hours per week.
Oh, that's pretty impressive number there. So now I will get here to some of the other questions. Now, some of these, I know people are, coming in at various times, so you may have addressed some of these, but it probably doesn't ever hurt to repeat information. First question that came in, when you do an EIE, as you don't want that immunization, does it show up somewhere?
Absolutely. That will actually show up in the entered in error within TouchWorks. So if you go to the all, either within meds or within orders for the immunization side, that will both of them come in under entered in error.
Okay, another question was someone joined a little bit late and wanted to know, where is the site and save being scanned from?
That's actually a pre-delivered little sheet that we give to you. You guys tell us what sites you need to have. We give you back a scanned sheet that you can have. I know Colette printed one off for all of their nurses. You guys can kind of decide where you want that, but we will give you whatever barcodes you need for those sites.
Now, I think I heard you talk a little bit about this, but is there an alert if there's an expiration on the vial as you're scanning it?
As far as expiration on the vial, we don't have anything there yet. That's not something that could be added, but right now there isn't any alert for the expiration date. We do have the alert if it's the wrong NDC.
Okay. And this is with reference to admin access. Does the admin access have different security than the admin page? So in other words, can a user work in the admin page without being able to grant admin access to other users?
So right now, we don't have it set up that way. Right now, you get the whole access of the admin page, as well as the ability to add in other people's access. We could definitely discuss that piece with a developer as well if that's something that's needed for your specific clinic.
Okay. And let's see. Why does one need to enter the manufacturer and NDC in the setup? Isn't that information picked up from the barcode on the vial? Or is that specific to the material?
Yep, so that's a great question. You definitely would not need to put it in on the setup. If it comes in from the vial, that will work that way. What we did or what we have seen is actually some clinics, or not clinics, manufacturers have light colored barcodes that aren't scanning with the highest resolution of scanners. Mm-hmm. And so if that's the case, or if they don't have that 2D barcode, which we've also seen, at that point they can still scan in that 1D barcode, which still contains the NDC, and then they can put in that lot number and expiration date within those settings. So you want to kind of consider every situation that might happen.
And now, will this work with Allscripts version 15.1?
It sure can.
Okay.
And we do have a clinic live doing it. So.
All right. Now, this is a good question. How much back-end setup does this require?
So as far as back-end setup, I showed you the admin side to set up the actual immunizations and immunization items and or immunization item groups. as well as the med items. So as far as what happens on the server side of it, we would ask for a location within SQL. So as long as we have access to SQL, we create a different database for either meds or immunizations. And then we're going to also put in some website values as well as update some IIS. But other than that, it's a very quick setup. It's not a lot of updates, and we've seen quite a few people just put it right within their TouchWorks database.
So that kind of answers the question, what's the installation process?
Yep.
Okay, very good. Do you have anyone using this with the MD charge module? So the med admin would drop in MD charge.
So that's another great question. So right now we don't have the charge piece going yet. So how we've taken the whole barcode reader app is phase 1 was the immunizations, phase 2 was the med admin, and phase 3 we're actually working on the charge side. So we've heard throughout many different clinics that that charge piece becomes a challenge based off the different and the numbers of immunizations you're giving each time and which codes to apply. Understanding Allscripts doesn't have a great process in place, our phase 3 approach is hopefully going to bypass that and actually get it right into that encounter within TouchWorks. So that's something that we're hoping this summer to the fall time.
Okay.
As our phase 3.
How about VIS information? We'd have to go back into the immunization and enter that information, or does that populate?
So the VIS, we've included the date as well as that it was given. If there's more specific things that your clinic is asking for, that's definitely something that we would be able to pull, but we would need to look at that on a clinic-by-clinic basis.
This goes back to the question about expiration. If an immunization is expired and not noticed by staff, would there be a possibility that that would add that that you could administer an expired medication?
So it's kind of taking the TouchWorks side too. So regardless, unfortunately, any nurse could probably pick up a vial that wasn't expired. It would be, you know, one of those things. We try to do some of those safe holdings and make sure those lots are all gone, you know, or the ones that are expired. But yeah, right now there isn't anything that would say, wait a minute, your hand just picked up the wrong thing and put it into that child's size. So it's more of the entry of it.
Got it. Is this interface using the Unity API?
As of right now, we set it up so that it can use Unity API. We're working with Allscripts to have those pieces connected, but right now it's doing direct database calls. So that will come in the future. It's just we're waiting on Allscripts for some pieces on that.
The user asks, we use a lot of nurse schedules where the billing and performing fields under med admin needs to be altered. Would staff need to do that before they record admin using the reader?
Yep, so right now we don't have anything within the billing side of it because we haven't gotten to the charge piece yet. That's definitely something I can take as a takeaway to look at a little bit closer to try to see if I can duplicate that workflow.
Another real basic question, what kinds of scanners, what types of scanners are used?
So we've tried a couple of different ones. Colette, do you want to tell about yours?
I was just going to say we use the Honeywell 1900 model, which seems to be working really well for our nurses.
Another one.
Go ahead.
Another one that we also have tested out is a TEMI brand, T-E-M-I. That's the one I'm actually using. I can say on this one, I ordered it from Amazon Prime, which any 2D barcode scanner is great to use. However, this one was a little bit on the lower end. Doesn't have quite as good of a DPI as what some of the higher end Honeywell. We also have a clinic, that's using a different brand, and I'm going blank on it right now. But regardless, the key to all of that is it needs to be a 2D barcode scanner. I know that we have a couple of clinics that are using ones that they've used for labs previously. So whatever works, as long as it's 2D.
Okay. Does entry within the barcode reader application affect what's being sent to our registry?
Oh, that's a great question. So right now, because all those direct database calls occur, whatever is actually transferred in from the barcode reader app is going into those same fields within TouchWorks. So everything will run the exact same way as it would have if you would have entered it in TouchWorks. It's mainly trying to save those clicks for the clinical staff and for the physicians.
Okay, here's another question about doses. Can you enter different doses in using the same immunization?
Yep. So one example that I've seen this happen for is actually the influenza one. So the standard dose there is 0.5. However, I know that some clinics for the 3 to 5-year-olds are giving a half dose of that. They're not giving the adult dose. And so in the admin page, you can actually enter 2 different items there, one for influenza 0.25 and then another one for influenza 0.5. And then you can just assign those to the appropriate group.
Okay, I've got one more question here. What specialties do you really see from benefiting using the med admin piece?
So a couple that we're working with right now, oncology is a huge area of benefit. I know there's a lot of different medications that get administered throughout those patients' visits, as well as ortho. We see quite a few injections for bursas and knee injections, arm injections, etc. Allergy potentially would be another good spot where they're giving lots of different administrations within, and really any family practice, internal med, anybody that's really doing anything within the clinic can utilize the software. So really any specialty.
Okay, and that about winds up the questions that I think we can handle today. And if there's anything else you want to add, we will just conclude today's webinar by saying that if you want to schedule an exploratory call or product demonstration, if you had a more specific question that we weren't able to address here today, you can contact Rochelle Herbert at EHR Integration Services by just calling the number you see on the screen or emailing Rochelle. And we thank you very much, Rochelle and Colette, and we thank everybody who was with us here today. And if you do have any further questions, please feel free to reach out to us. Thank you again for your time today, and we look forward to hosting you again on an upcoming Perfect Practice Alliance webinar. Have a great afternoon.